practices, those who go into wards, why are they always said that wear shoes? This is only because to save yourself, because your feet could also come in contact with something like that. Okay, something of that sort. In clinical wards, there are so many types of patients with so many infections. So your feet is always on the ground in the ward. So that's why closed shoes are always important. Closed feet shoes. Okay, so wear protective clothing which serves as an effective barrier against potentially infective material. When leaving the laboratory, protective clothing should be removed. Now again, protective clothing means, as I said, that you should be covered. This apron, it's a protective clothing, and while leaving, so suppose you wore the apron, you had an experiment and it spilled on your apron or somewhere. So you don't just, continue your rest of the class with it, you should change it and then you should continue. Even if it was, it was infected, so that you don't spread it, so it's advised to change it. Okay? Tell me if I'm going too fast, okay? Now use disposable syringes and needles. Now what does that mean and why is this so important? Disposable syringes and needles. What could happen if we don't use disposable syringes and needles? Yes. Now what will happen if I use one injection for patient A as well as B, C? It will spread. That's why disposable syringes and needles are important. But earlier, when I was an infant and I got my vaccination, that time there was use of glass syringes and metal syringes. Did anyone see glass, metal syringes? No. So that time use of the glass and metal syringes was very common. So they used to, suppose I got vaccinated with this, with the same syringe, that they would boil it and then they would again use it for maybe another person. Okay, so that, please don't talk. Yes. Sterilizing what?
You said that the syringe, the same syringe is used. So you said that boiling, that I think sterilizing the same syringe and using it.
Yes. Group discussion, self-discussion can be done after class also. Yes. So, yes, so it breaks the flow, So yeah, this is why it is important, so that we don't spread. If one person is positive for anything, it doesn't go to the next person. Now blood can spread a lot of infection and diseases, isn't it? Yeah. So disposal of all sharp objects appropriately. Suppose, okay, what are the sharp objects that we can come across in hospitals? Scissors, yes. Knife, needle. Scalpel that you are using in anatomy, yes, that is sharp. The blade, those are sharp. So why is disposal of it very important? Proper disposal of that very important. Injury. Injury to whom? No, we already disposed it of. Animals. Yes, it could cause harm to animals and the surrounding. So that's why dispose all sharp objects appropriately. That is very important. Now I'll tell you how to dispose it. Now avoid reusing syringes and dispose of all needles in rigid containers without touching this using one-handed technique. This is very important. Now why is this so important? What do you think will happen if I don't dispose of the needles in rigid containers without touching this using one-handed technique? With one hand I'll dispose it. Why is this point so important? Have you heard of needle prick? Needle prick in hospital setups, health workers, needle prick. You know what it is? See, for us, the health workers, what happens is we deal with lots of patients, right? So we draw bloods. So it's very important even for checking the random blood sugar of a patient. When you'll get into internship, you'll do that. You'll check the random blood sugar of a patient just with a prick. Okay. So while doing that, what happens is you can also get a prick. You can get a prick And it happens. It's not something that I'll be very cautious. At least once in your life that will happen. I myself got a needle prick, while doing checking sugar of a patient. This is very common. So getting needle pricks is, it's a very common thing. Obviously, we should be cautious and all that. But the thing is, we handle with needles and this syringes so much, so it's very easy thing. And it happens. So disposing the needle and touching in a rigid container without touching it using one-handed technique, as well as after the prick, how do you dispose it? Not touching two hands, just with one hand. Okay, and that too, the syringe. Suppose this is a syringe. This is a syringe. Now there's a needle part which you get pricked while taking blood, right? And there's a plastic part as well, the one they pull. So the two parts go in two boxes, in two containers. The needle first it gets burnt. Okay, it gets burnt. There's a small machine kind of a thing, electrical. It gets burnt there, and then it goes to a white transparent box. Okay, and in that white transparent box, all the sharp objects go. You cannot discard the whole of the syringe into one container. Okay, am I making you understand what I'm saying? So the needle always goes into the white transparent container. And why is it transparent? So that people can understand that there are all these sharp objects there. So that's why it's transparent. So to avoid needle prick, we should be always very cautious to save ourselves. Do not touch your face with your gloved hands. Make a habit of keeping your hands away from your mouth, nose, eye, or any other mucous membrane. This will reduce the possibility of infection. Now, once you're wearing a glove, after your hand wash, before wearing gloves, you should always do hand wash. After removing your glove, which is wash hands whenever gloves are removed, you should always do hand wash. Now, why is it important to do hand wash before and after wearing a glove?
Before, because also if I have some germs.
Yes, to germs, to remove the germs, yes. And afterwards?
So that the patient's infectious germs.
Yes, exactly, for that. Now, gloves are very sterile. Gloves are sterile. So, once you wear them, you should not touch your phone, your hair, your face, anything, okay? Now, you tell me the steps of hand wash. That was showed, I think. Hand wash, tell me. Hand wash. Hand wash. Yes. Oh, you were not there. Okay, who can tell me? Hand wash, yes.
And first of all, we just apart from that back.
No, that is the second step.
Full round.
That is the fourth step, I think. Okay, this is not in your biochemistry, but this is very important. Hand wash is very important, and you get questions from hand wash. The steps, the time, and how many seconds for each step. These are important, okay? But I'm just giving you a brief kind of idea. But this is not in my topic. Anyway, first hand to hand. Okay, back of the hand, crease of the fingers, crease of the palm, okay, thumb, okay, tip of the fingers. Okay, you can recall little I think. Anyway, this is not so important in my topic, but I'm just giving you some idea. So 2 minutes for hand wash, 20 seconds for each step, in short. So that is very important, and once you are done hand washing, how do you close the tap? And how do you keep your hands? With the elbow. And how do you keep your hands? Like this. When you go to OT, surgery OT, you will see the surgeons are very particular. Once they have done hand wash, they are not touching anything. Just directly they will go into wearing gloves, gowns. Okay? So do not leave open flames unattended. Now, if you go into your biochemistry lab for Benedict test, you will need flame. Fire you will need. So what will happen if you just leave the flame unattended? It can catch fire. Likewise at home, we don't leave our gas stove open. Yeah. So smoking, drinking and eating in the laboratory should be strictly prohibited. Minimize spills and spatters. Okay, so smoking, now lab is not a place to eat your food, drink, smoke. This is not a place. Okay, it might catch fire as well from the smoke, from smoking. So that should be avoided. Now you can say that, yeah, ma'am, I can perform my experiment, but I'll use a spoon to eat my food. Some do it, but it should not be done because the spoon itself can get contaminated and you are not seeing how the chemicals are going, till what part it is going. So it's best to avoid it. So work area and reusable devices should be regularly disinfected. Decontaminate all surfaces and reusable devices after use with appropriate registered hospital disinfectant. Now you did an experiment. Suppose you are group A, you did an experiment and you just left the lab like this. Will it be good for the next group? It won't be. If there was a spill and you just left it, will it be good? It won't be. So clearing the area so that with proper disinfectant, it's always good. And also the washing or properly cleaning of the reusable devices like the test tubes for a safe or the beaker. Cleaning is important. So all sharp objects and infectious material should be properly disposed of. As I said, if we don't dispose the sharp objects properly, it could cause harm to us or our surrounding environment. And infectious material should also be properly disposed of. Okay? Now these are some signs which you should know. A laboratory worker should know the meaning of the following signs. Now before you do any lab work, you should know what these signs mean, okay, for general knowledge. Now what is toxicity? Poisonous, yeah. What is acute toxicity? Acute toxicity. What is the meaning of acute? What is the meaning of chronic?
Very less period of time.
Yes, and what is the meaning of chronic? Long term. Acute means short term. Now what can both the words, if we merge together, acute toxicity, what can it mean? Short time acting. So when you go to any hospital ward, suppose for say you went to medicine ward, okay, for your clinical postings, you went there, you will see their patients who ingested poison. You will see lots of it will be there. So that is acute toxicity. They took the poison, okay. So for an example, what is Tripura famous for? Don't tell me drugs. Rubber production. Now drugs is totally another topic. Okay. Now why? Now if you tell me drugs, now I'll ask you why is Tripura famous for drug abuse? Now that question who can answer? Why is, if you are saying some of you have said drugs, right? Now why do you think drugs and HIV? Somebody yesterday told me HIV. Now why do you think drugs and HIV? So that is a different topic anyway. So rubber acid, as I've said, rubber production. You will get to hear it. I think you heard also rubber production in Tripura and Kerala. Yeah. So the rubber acid is a rubber acid poisoning. It's a very common thing in medicine wards. The person has ingested rubber acid and it's very common and easily accessible. The rubber factory workers, they have the access to it very easily. So rubber acid poisoning, for an example of acute toxicity, or OP poisoning. Have you heard of it? OP poisoning, organophosphorus. Have you heard the term organophosphorus? Organophosphorus is used by our farmers. Okay, this is a pesticide used by farmers in farming and all. So that OP is also very common thing. The OP poisoning, some cases are very common in medicine wards. So those are acute toxicity. Now what could be chronic toxicity? Something that is acting for something that we are taking for a prolonged period and it's causing toxicity to the body. Now can someone give me an example from your class 10, 11? Any chronic toxicity? Kind of, yeah, smoking. Have you heard the term Minamata? What was it? Mercury intake. Have you heard little? You can recall now, little by little. Yeah, what was it? The factory was releasing mercury into the water. The fishes were intaking it, and the humans were eating the fish. So indirectly it entered into the human body little by little, slowly by slowly. So that is chronic toxicity. When it's entering to your body slowly, little by little, every day, for a prolonged period. Another could be in West Bengal. Have you heard of arsenicosis, the black feet, black teeth? Come on, this was in your undergraduate only. In your high school, no? Arsenicosis, okay. So in West Bengal, that thing was there. The arsenic was being released again in the rural areas of West Bengal. The arsenic was released into the water again, and the people were taking the water. They were drinking the water, and then they were having the complications as well in their various systems in their body. Okay. So hazards to the environment. You will tell me, what are the hazards to the environment? Yes.
Like acid rain.
Acid rain. What did you say?
Acid rain.
Acid rain. Have you seen acid?
Acid rain.
Rain. Brishti, right? Rain, yeah. Have you seen acid rain?
No, but it hampers the.
Did it happen anywhere? Yeah. So, and anything else? Taj Mahal turned in color, yes. So, anything else? Acid rain, yes. And? Yes, forest fire.
Toxic gas release.
Toxic gas release, yes.
NO2,
Anything that is hazardous to the environment, in short, from your environmental science, air pollution, sound pollution, noise pollution, soil pollution, water pollution, these are all hazardous to the environment. Now, health hazards or hazardous to the ozone layer. Now, who can tell me? Ozone layer, how is it affected? CFC, global warming, yeah, greenhouse effect. So somebody in your last class, somebody told me, no ma'am, the ozone layers are healing. Okay, the ozone layers are healing, ma'am. Yes?
There was a headline, I think I saw it, but
In Google. Yeah. So I'll tell you why. Nowadays, when we scroll through internet, Facebook, Insta, we see a lot of newses, right? 2 line, 3 line. So they just give that much. The ozone layers are healing. Congratulations. So what after that? No, we are relieved. The ozone layers are healing. But what after that? What about the rest of the article? Where is it coming from? What is the source? What is the authenticity? What is the reference? You can argue saying that ma'am said the ozone layers are affected, but you are saying that we saw that no, the ozone layers are healing. But what is the source of this statement? Nothing. Some meme page. That Rajinikanth versus CID joke meme page could be the source, isn't it? I also come across those things anyway. So when you see such things in internet, have a habit of reading and researching. Always go through it with a proper reference. Googles give you half knowledge, Always prefer textbooks, because something that is in the book underwent a lot of correction by lots of people. You, me, we can also publish things in Google. That is very easy. Yeah, we can do. Who do you think are publishing all these things in Google? All these articles. If it doesn't have a proper reference, it's not valid. And if you see it, if you research it, you will understand. Anyway, the CFC, as we have said, we are using ACs nowadays. ACs. So yeah, so that is causing hazard to the ozone layer. Now, the ozone layers are healing. Healing. It's a process, not healed. It's healing. It is expected to be healed by 2066. It's 2024 now. You are first year MBBS. It's a long journey. Okay. Likewise, it was said that glaucoma. You know what is glaucoma? Disease of the eye. Okay, it causes blindness. It's a silent disease. Glaucoma was supposed to be eradicated in 2020. 4 years back it was supposed to be eradicated. There was an aim. So these things are aim. Okay, some medical fraternities, there's some bodies working to aim for it, like polio. They're aiming to eradicate polio. Like 99% cases have dropped, but there are still cases coming up. Okay, so these are certain aims. So glaucoma is still there. It's still there, okay? Like, tell me one disease that is completely eradicated from the world. Smallpox. Smallpox. So, that is what it is. So, serious health hazard. Now, what is serious health hazard? If there is serious, there could be something that is not so serious. So, what are some not so serious health hazard you can come across in your biochem lab? Huh?
Burning.
Burning. Burning of what? Skin burn. Not so serious. Yes, and very common thing. Itching. Yes, itching, as well as we are dealing with lots of glasses. I have said a broken glass broke and you have cut your finger. So it will not be that serious. Now what could be something that is very serious? Acid spill could also be, if it's a small amount, it could not be that serious. Now, if it's a very big amount, that could be serious. Somebody, synthetic clothes catch fire very easily, right? Somebody wore a synthetic cloth and it caught fire. Maybe from here it caught fire. Now, it can burn little bit, as she said, burn little bit, or it could burn your body as well. Now, there is degree of burn and all, that is a later thing. You will learn degree of burn, how much, what is the percentage that is there. Anyway, so that could be hazardous. Somebody inhaled something, consumed something by mistake, accidentally, that could be hazardous. Something went into your eye, some amount of acid, as she have said, it went into your eye. It could be hazardous. So, those are serious health hazards. Now, gas under pressure. What is the common gas that is under pressure in hospital setup? Oxygen cylinders, exactly. So, oxygen cylinders are kept under pressure in cylinders, oxygen cylinders for patients. So, that is gas under pressure. Now, what were the 4 hazards that I said we can come across in our health setup? The first, in my second slide, I said 4. Chemical, fire, electrical, yeah. So coming to that, chemical hazards. This apply to all who use chemicals in their work. It is wise to regard all chemicals as toxic unless you know otherwise. Yes, chemicals are always toxic, not to play with. Okay, not to have curiosity of let me see it close, bring it close into my eye and let me see it. The color is very beautiful, pink in color, it's very nice, blue in color, no. It should always be, it is advised to always use chemicals with proper precautions and always refer to it as toxic unless otherwise. So the main dangers to the person are associated with toxicity, chemical burns and dermatitis. Yes, ma'am. You will tell me what is dermatitis or chemical burn. What is dermatitis? Do you have any idea? Yeah, kind of. Anything inflammation of the skin. For now, you can know anything irritability of anything of that sort. That is dermatitis. So, a person, as some of you have said, that we can come in contact with the chemicals, 1 or 2 drops in our hand, and that can cause us dermatitis or irritability or any sort of burn. Now, chemical-related risks of explosion and fire are also possible. Yes, we are using flames in our labs, so that could be cause of fire, since our labs are filled with so many chemicals. Toxic symptoms may follow ingestion, inhalation and skin absorption. Yes, ingestion how? If suppose, as I have said, somebody is using a spoon and eating food while experimenting, accidental ingestion is very easy to happen. And inhalation, I have already mentioned, while you are taking a experiment, the fumes come out. So while you are taking, you are breathing, it can enter to your body, it can go and affect your lungs. Okay, so skin absorption, again, if you have any cut, why gloves are important? See here, it applies. If you are having any cut, any micro cut, we will not see also. So through that also it can get absorbed to your body, and it can get absorbed. Now swallowing strong acid or alkali causes corrosive poisoning. Swallowing, now who will swallow? Only the foolish people will swallow. If they enter to your mouth, it's always advised to spit it out. Don't swallow it, always spit it out, and you should always wash it with the mouthwash. Okay? Otherwise, it could be hazardous. Now, physical hazards. Hazards of glass are the biggest cause of lab accidents. Yes. The lab is filled with only glass and glass. So getting a cut from a broken glass is very easy. Now more than 30% of all laboratory casualties are cuts from broken glass. If one is not careful enough, profuse bleeding might result following a deep cut. Now what is a deep cut? And in which artery, if we get a cut, we could die in a mere 3 minutes. You had your what call anatomy, you're having anatomy dissection, right? You're not having? No, not even one class? Okay. So have you, you will hear it furthermore, femoral artery. Okay. So if you get a cut in your femoral, deep cut in your femoral artery, and you are not treated immediately, you could die in 3 to 5 minutes. Okay. So getting a cut, it should not be like, yeah, a finger, a simple cut here would be, yeah, it's a cut, we can take a first aid and fix it. But a deep cut should always be taken seriously. Now, the glass may also be contaminated with stool, pus and bacteriological cultures, resulting in severe infection. Now, if the glass that broke and cut cut your finger, maybe if it was contaminated with any stool or pus of the patient, okay, it will enter to your body as well, right? So it could be hazardous to your body. The disease could get transferred to your body, right? So accident occur in the lab mainly through ignorance, lack of foresight and lack of care. Now we all think that we are all careful, right? No, it's okay, nothing will happen, nothing, like we are all little daredevils nowadays, hot blood and all that. So that's how accidents happen. The RTAs, road traffic accidents, that's how it's occurred. We all think that, no, we are fine. We are all driving nicely, but that's how casualties and accidents occur. Okay, that's why we should always be careful. Now, a careless worker endangers not only himself or herself, but also his or her colleagues as well. Now, if you are working, suppose the ma'am in the green sweatshirt. What is your name, ma'am? Arnima. Are you from here? Bihar. Okay. So, suppose ma'am has spilled something. Maybe a reagent she has spilled in the lab or some chemical. So, will it only harm her and not the rest of you? No, it will affect all of us who are there inside the lab. So if you have spilled something, that could be dangerous to your friends as well. Now electrical hazards. What are some electrical hazards I said earlier? Short circuit, loose wiring, open wires. Why do we do earthing? In our homes, we always say the earthing. Why is it important? He's using his phone, I can see it. Do you think it's a joke?
No.
Didn't I tell you to silent it before?
Yes, sir. Just habit. That's why it's healthy.
So this kind of nonsense will not be tolerated from the next class, okay? Presenting, when you will come and stand this side and present something, you will understand and you all will get your chances. This is not a joke. This kind of distraction breaks the flow. This is the first and last time I am telling you all. Yeah, as I was saying, why do we do earthing? To avoid electrical hazards. Now, what will happen if we don't do earthing? What happens? The thunder will fall. Yeah, have you heard of it? What does the earthing do?
It transfers
Into the ground, exactly. So that's how it can be caused by faulty electrical circuit. Okay, incorrect installation of equipments, touching exposed live wires. Now suppose if there is an exposed live wire and out of curiosity someone is like, no, let me go and see how it feels. No, that is not advice, that is foolishness. Use of extension cords is prohibited. Now nowadays all of us, we don't see eye to eye or walk straight. We see to our phones and walk while texting someone, while replying to someone, scrolling through Insta or something. So if there is an extension cord, we could tip and slip, right? So that's why it's prohibited to use extension cord. Now OSHA regulations stipulate that the requirements for grounding of electrical equipment of the National Electrical Code published by NFPA to be met. Now all electrical equipments must be turned off after the use. This is very basic. We all say once we leave the room in our home, we always, when we go to the next room, we always turn off, right? This is very basic. Now fire hazards. What are the fire hazards? A significant fire risks exist in laboratories due to frequent use of matches and open flames in close proximity to highly flammable chemicals and reagents such as acetone, diethyl ether, methanol, acid alcohol and stains that are alcohol based. The labs, okay, any lab where there are experiments performed, these are closed setups. Like suppose this is a lab, it's a closed setup. There are lots of chemicals which could catch fire easily, and we need that fire source to perform a test. So it's very easy to catch fire inside a lab. Now who will tell me? Yes, you. Yes, stand up. Tell me a substance that we use in our day-to-day life that can catch fire very easily.
Mobile phone.
Mobile phone.
It can burst.
It can burst. Will it catch fire? Where are you from? Tripura only. Which school? Bhavans. Okay. So mobile phone, no.
Then socket.
Socket. Most of you have used it. Okay, sit down. Most of you have used it. Huh? Did you use petrol, diesel before coming here? Perfume, exactly. Perfume. You always see that fire sign, right? Don't bring in front of fire. That perfume bottle always has that disclaimer. Yes, alcohol, because it's alcohol based. Basically the perfumes are alcohol based. Also the sanitizers, those can, we are always using it day to day life, so those can catch fire easily. Fire may be also caused by overheating in faulty, poorly maintained electrical equipment, overloaded of the electrical circuits, overheating of electrical motors due to inadequate ventilation. That's why ventilation is very important. That you will get in your community medicine. Why ventilation is important, how big should be the windows, how much should be the doors, that you will get in your biochemistry. In your community medicine, Fire blankets for smothering fire on clothing should be available and easily accessible. Now what is smothering? Anyone who can tell me what is smothering? Yes?
Covering up the flame.
Yeah.
The flame can't get more oxygen supply.
Yes. Now can you tell me where we see smothering? We have all seen smothering. Have you seen? Anyone has seen smothering? Yeah, I know smothering is covering fire, but have you seen anywhere? I'm saying. I know you have seen, but can you tell me that you have seen? Cylinders. Yeah, have you done it in your home? Yeah, I'm telling you, you have seen it. How? We all watched Bollywood movies. Have you seen if a person is on fire, they run with a blanket, right? So all of us have seen it. So that's smothering. We have all seen it. And also if somebody has said, As ma'am has said that the cylinders, we all know it, that if a cylinder is on fire, we should put a wet cloth on top of it, right, to cut the oxygen supply. So the location of the fire safety equipment and location of the fire alarms and maps of evacuation route are directed by local fire marshal. Now, laboratory first aid. Now, you know everything, what could be the hazards that you could come across and all that you know. But if there is a hazard, suppose there is an accident of splash of acid or alkali onto your skin while performing something. Now, what to do in that case? So, what is the first aid that we should use? For an acid splash on skin, wash with tap water and then with 5% solution of sodium carbonate. Alkali splash on skin, wash with tap water and then with 5% of active acid. Phenol burn, wash with plenty of tap water, then use polyethylene glycol with water. Splashes in the eye. Now this is very important and very common. Splashes in the eye, wash immediately with plenty of tap water and sterile saline and seek medical help. If you ever feel that something, but you are confused, but you are also in doubt that something went into my eye or not, don't just sit into your room. You should definitely get to an eye specialist, an ophthalmologist. Okay, you should definitely get an eye checkup. It's better to be confirmed than to just be in dilemma. Now, accidental swallowing, spit out immediately, wash with dilute antiseptic mouthwash and rinse thoroughly. As I have said, only foolish people will swallow it. It's better advised to spit it out and wash immediately with an antiseptic mouthwash. Now, injuries caused by broken glass, wash wound immediately with a disinfectant. Minor burn, bathe the area with cold water and cover with sterile dressing. In all cases, after first aid, seek medical aid at the earliest. So these are just handy for the immediate treatment, but you should always go to a higher setup, to a doctor, to a specialist, to be confirmed that it is not going to affect you in any way possible. Okay? Now, first aid kit for ready use. Suppose someone has got a burn and we are all acid burn and we are all running for alkali. That will not be good, right? So, we should always have first aid kit ready use. 5% aqueous sodium carbonate, 2% sodium bicarbonate, saturated boric acid, betadine. We all have heard, we know what is betadine, right? Day-to-day use in our households, we have used it, betadine. Now 5% acetic acid, glycerin, Dettol and Savlon, that is also very common to us, Dettol, Savlon. Antiseptic mouthwash, sterile gauze or cotton, band-aids, adhesive tape, scissors. Now we know what is band-aid, adhesive tape, we know what is sterile gauze. Sterile gauze, have you seen sterile gauze? Yes, exactly. In local terms, as we say that patti we do, that is that rolling thing we do, that is what a sterile gauze is. Anybody noting? Should I wait for some time or I can go to the next slide? Can I change it now? Okay. Now, hospital waste management. You all have been to hospital setup, most of you. Did you see these colorful containers? You have? But we don't know what goes where. So hospital waste management, it's very important, and it is very important not just the 5 years of your course but the lifetime. Now since you are medicos, you should know where what goes, where do you discard which item. There are so many types of waste that are being generated from hospital, and it is very important to discard in the exact container that it is supposed to go, otherwise it could be very dangerous. Okay. So hospital waste management is of two types, general waste and biomedical waste. Now in general waste we have black container. You can see the black container, the black color. If you want, you can click a photo of it. The black container, this comprises of 85% of the total waste. This is important not just for now. In your community medicine, you will get lots of questions from this biomedical waste management. So, the black container comprises of 85% of the total waste, which is segregated in black container. Okay, so what are the waste that goes in the black container? For example, suppose this pen, the paper, that all things that are day-to-day life uses, anything, the vegetables, the peel, the banana peel, or the apple peel will go, rotten apple will go inside it. The day-to-day life uses, things will go into the black container. Now, coming to biomedical waste, that is in yellow container, human anatomical waste, animal anatomical waste. Now, what could be a human anatomical waste? Please be loud if you are answering, be very specific. It's okay to make a mistake here. I'll try to correct you. It's not like I know everything. I'm a human. I could also make a mistake. But I'll try my best to correct you. If you're answering something, be loud, because it's better to be a fool for 2 seconds rather be a fool for the lifetime, isn't it? So if you're answering, be loud. What could be anatomical waste? You're doing anatomy, right? What could be the anatomical waste? Huh? What? Veins. Organs, exactly, organs. Where does the organ go? After any operation, where is the organ going? You have heard your relatives going through laparoscopic cholecystectomy, right? Or cholecystectomy operation, that gallbladder infection we say, right? So after the OT, your relative is going home, but where is that gallbladder going? What happens to that? Or for an example, suppose somebody has a necrosed body part. You know what is necrosed? Some body part, suppose in diabetic patients mostly it happens anyway, that is different. I'm just giving an example. Necrosed means the part that is not getting blood supply, so it turns blackish in color. Okay, so you have to amputate. You know what is amputation? Cutting the part out of your body, so you have to amputate. But after amputation, where does it go? Any minute thing, from could be the little toe finger also, but where is it being discarded? You just can't throw it here and there anywhere. After cesarean, after a baby is being delivered, where is the placenta going? You know what is placenta? Where the baby grows and all that. But where does that placenta go? What happens to that? If you just throw it somewhere in an open space, dogs and cats will come and attack to it, right? So all of it goes, any human anatomical waste will go into the yellow container. Now soil with infective secretions, example the gloves that are stained with blood, that will also go into the yellow container. Expired or discarded medicine, infective secretion from body, blood bag. Now There are so many medicines in our hospital. Some are expired as well, so we have to discard it and it will go into the yellow container. So infective secretion from body, blood bag. Have you seen blood bag? Blood bags? Have you seen it? Anybody? Have you seen blood transfusions? So that blood bag after the blood transfusion will go into the yellow container. And when you, I am telling you, when you are into your internship, you have to do blood transfusion. So after the transfusion is over, if you don't put it into the yellow container, the sisters will catch you, I am telling you. You have to discard it properly. I'll tell you why it is important. Now, vaccine and culture, yes. So the vaccine vials are of glass, but the vaccine itself that is there inside, that goes into the yellow container. All this waste should be burned. Exactly. All that goes into the yellow container should be burned. Now in red, IV tubes, bottles, serum container, urine bag, syringes without needle, gloves, vacutainers. Now you know what is IV tube, intravenous tubes? Yes, you see those saline, have you seen saline bottles? Something hanging in the ward connected to the patient. Those IV tubes, the wires, have you seen the wires that gives, yeah, those. And then the serum container, urine bag. How many of you have seen urine bag? You have seen urine bag? So after when we discard it, and syringes, as I have said, the plastic body, the needle gets burned and goes into the white transparent box. So this is not the white transparent box, okay? It's a glass box or a plastic one, small one, but it should be transparent. So the plastic body of the syringe goes to the red container. And what is vacuinators? Do you know what is vacuinator? Anybody who has donated, given blood recently for test? Anyone who went blood test recently? You? How was it taken? Did they pull it? Or was there was some suction kind of a thing? Yeah, so that is a vacuinator. Okay. So it's nowadays it's being starting to use. So it's kind of a negative pressure kind of a thing. You don't have to pull the old way. You don't have to put the syringe and then pull it. It's you just fix the needle and then put it, connect it. It comes with the negative pressure. So IV tubes, bottles, serum container, urine bags, syringes without needles, gloves. Now again, you see the gloves stained with blood will go into the yellow one. And the gloves which might be or might not be stained will go to the red one. Now all these waste products should be recycled. Okay. Now who will tell me why it is important, the red and yellow? What will happen if I suppose a patient had an operation. After the operation, the patient will be discharged now. So before discharging, we'll do the dressing of the patient. So the old dressing that we removed and we did the new dressing, what will happen if we put that old dressing into the red one instead of the yellow one? What will happen? Suppose you understood the question. Did you understand the question? Use your brain. Come on, use your brain. Last batch could answer it. What will happen if I put the old dressing, the dressing with stained with blood or pus of the patient into the red container instead of the yellow container? Yeah, it should not be recycled. Now what will happen if it gets recycled? When it's recycling, what are the things that go in the red container? IV tubes, bottles, serum containers, urine bags and all these things, okay. Some syringes are also getting recycled. So if you are discarding that infectious piece of whatever gauze or anything into that, so it will affect the rest of the things as well. This is basic questions and that is how you are going to get asked in Viva. This is the scenario that they'll give you, clinical scenario, no more direct questions in medical field, okay, clinical scenario. That's why you guys are having that early clinical exposure classes also. So that is why it's important to discuss exactly the things that should go into yellow, red, blue, black and white transparent box. Now in blue, metallic body implants and all types of glasswares and all these waste should undergo deep burial. Now metallic body implants, in ortho OTs they use yeah, exactly. In ortho OTs they use some body implants, okay, some metallic body parts which later on they take out as well after some time. So that should go into the blue one. And all types of glassware. Suppose there is a broken glass in your chemistry lab, in your biochemistry lab. So where will it go? After you collect it, you should discard it into the blue container. Now in a white transparent box, all sorts of sharp objects like scalpel, needle, blade, scissors, all these things will go.